Hello, leaders of the world. Welcome to Spread Love in Organizations, a podcast for purpose-driven healthcare leaders striving to make life better around the world by leading their teams with genuine care, servant leadership, and love. I'm Naji, your host, joined today by Sema Sgaier, CEO and co-founder of Surgo Health, a healthcare technology company developing a revolutionary social behavioral analytics platform and generating model real-world data designed to inform and improve health equity and outcomes by enabling a greater understanding of the complex factors that influence how individuals engage in their healthcare. Sema is a serial entrepreneur with close to 20 years of experience in healthcare. She co-founded and led Surgo Foundation and Surgo Ventures, where she led the development of analytic products that solve health problems with greater precision. She was initiative lead at the Bill and Melinda Gates Foundation, where she brought innovations in data, consumer insights, and product introduction into large-scale health programs globally. She has over 60 publications and is a frequent contributor to the New York Times and prestigious media outlets. She is an adjunct assistant professor at the University of Washington. She completed her fellowship in genomics at Harvard University, PhD in neuroscience from New York University, and MA in neuroscience from Brown University. Sema is a member of the board of directors of the United States of Care. She was selected as a rising talent by the Women's Forum for Economy and Society. Sema, it's such an honor and pleasure to have you with me today.
Such a pleasure to be here, Naji. Thank you for inviting me.
Can you share first with us your personal story from genomics to development and now being the CEO and co-founder of Surgo Health? What's in between the lines of your inspiring journey?
Sure. My personal story actually starts during my childhood. So I was born in Libya to a Libyan father and a Turkish mom, and I was born in a country where healthcare was actually really challenging to get. And I had a condition that required advanced care. And so my family had to take me abroad. And I spent a good chunk of my childhood in hospitals and a good chunk of my adult life having to get checkups. But that really got me inspired in health, and it got me really inspired in really bringing health to a lot of people. I was also, very interested in science. And so that led me to a career, or I started my career, I should say, in genomics and neuroscience, but very quickly missed the need or really missed working with people in communities. I'd grown traveling all over the world and really missed that. So the journey started with moving to India and starting on the ground, developing surveys in communities, in villages to really understand their needs when it came to health. Going door to door, asking families, asking mothers, asking husbands, asking children. And that was really the beginning of understanding the power of data and the power of the human voice in being able to inform not just governments in terms of what the gaps are, but really inform all sorts of activities in communities by companies, et cetera. So, long story short, I won't describe every step, but I ended up then eventually joining the Bill and Melinda Gates Foundation in India and lived there for 7 years, working on an HIV prevention program, again, working with communities. And then from there moved on to work on HIV prevention in Southern and Eastern Africa. The key part and the crux of really what I do, and I can dive deeper into this, the key part of what I learned in all of that work is that we really need to understand what people need on the ground and what is behind their actions, their decisions when it comes to how they interact with healthcare and how they consume healthcare. And for me, the really big question that we need to answer is the why question behind people's behavior. Because we often don't approach healthcare, by trying to understand the why. We start with what's happening in the ecosystem. And so the three organizations that I co-founded, and I'll go, of course, into more details: Surgo Foundation, Surgo Ventures, Surgo Health. Really, the core mission of all three is bringing a big data approach to answer that question for every single individual, so that we can inform healthcare in a way that's personalized to everyone.
Thank you so much for sharing part of your journey. And this is really a great segue. My question, actually, the first one was the mission of Surgo, the different entities. And really, if you can tell us a little bit more, your vision about data and how you're going to be able to answer those health issues?
Yeah, absolutely. I mean, let's start with just thinking about each of ourselves, right? And the people that we know. So we know that what people believe in, who they trust, and how they trust. The various barriers they face in the ecosystem, whether it's the time, whether it's the transport, really impacts how they interact with the healthcare system. And so, but when we look at the health ecosystem today, there's a lot of data. There's no lack of data. We're actually swimming in billions of data, but a lot of it is really telling us, as I mentioned, what is happening. So we can map, for example, in the US, the complete journey, which providers did people see, what were their diagnoses, what medications did they take. So that really tells us, that pathway. But if you were to ask me, okay, so why did this person living in this community not see a provider in the first place? I would be hard pressed to find that data, readily available. And so really the mission of Surgo, when we started Surgo Foundation, it was really an operating foundation meant to incubate an idea. And it was really meant to incubate this idea of how can we bring a big data approach to really understanding people? So not beyond doing focus groups and having conversations, but how do we generate this data at scale? And more importantly, how do we analyze data? So what are the innovations in the analytics space? And then how do we make it actionable for various stakeholders? So Surgo Foundation, again, was really meant to demonstrate, incubate this idea, and we successfully did that in various programs, actually in India. And then that led to the spin-off of Surgo Ventures, and from there, Surgo Health, which happy to go into the why behind those spin-offs.
Yeah, I love it. Before we go into the why of the spin-offs, can we double click, because you're talking really about something that means a lot to me. Insights, right? Like you're looking into patients' insights, customer insights to understand the why. Can you share with us some specific example of how do you gather those insights at scale? And then how do you run those analytics for us to be able to solve problems, as you say, with precision?
Yeah, there are many ways to gather data, but I think fundamentally where you have to start is what is it that you want to collect? And I think one of the things we learned very, very quickly is that stepping back and really being clear, what are the variables that need to be collected to answer the why question is really an important part of the equation. And so we've built over the years a multidisciplinary team of actually scientists, and I would say behavioral scientists who come from various disciplines, right? So when people approach human behavior, they approach it from various disciplines, right? You have the behavioral economists who are really looking at just biases and heuristics. You have social scientists who really emphasize the social ecosystem in which people live. But in reality, all of these things really matter. And so the approach we take in designing these data collection efforts is stepping back and saying, beliefs matter, biases matter, heuristics matter, social norms matter. And then in the context, the laws and policies matter, the systems matter, the access, influencers, media, all of these matter. And so we really need to be comprehensive in what we collect and so that we can get a complete picture. And so the first step is really making sure that you have a good sense of what you want to collect. The second step is then, of course, figuring out how you collect it. And we have various methodologies. But one of the things that we do to get scale is actually design large-scale surveys. So we collect data in the thousands, tens of thousands, and sometimes hundreds of thousands, depending on what platform we use. Whether we use some of the social media platforms in a way to get respondents, or whether we use panels. So that gives us the first scale, and then from there, we apply our machine learning analytics or predictive models approaches to be able to then predict that for all the people that were not part of that initial data collection effort. So there are various steps in this journey.
Thanks for sharing those. As I was looking, you've done incredible work, obviously, on several different disease states. HIV you shared about. I saw your work on COVID-19 and the CDC's taking it. I kept thinking data precision science really in an era where I'm like many times I'm feeling misinformation, like wrong theories, hate, populism is somehow ruling sometimes policy actions, but even like people's actions towards their health that is actually harming them. So since you're collecting those data, are you seeing this trend? Is this something real that you're seeing? Is this something that is coming out? I would really love your thoughts about precision in data and then actually what we're seeing that is more fictional, I would say.
Yeah. Unfortunately we are. And during the COVID pandemic, we did see, and in fact, we were one of the first and few who tried to really measure some of this misinformation. Particularly, we measured conspiracy theories that people were believing in. And so we really looked into what are those theories and actually went in and measured those. And when I say measured, really tried to understand what percentage of people, for example, believe that, government is using COVID to control people, are implanting chips. Like there's all sorts of conspiracy theories. And so we wanted to see not only how often, but really who specifically is believing these conspiracy theories. I think when it comes to misinformation and you talked about data, people at the end of the day believe in stories. Right. It's not about the data. It's the story and the power of the story. And even as scientists ourselves, what's really on us is when we want to communicate our data, the, quote unquote, real, true data, we really have to put effort in using stories to tell that so that people can really align to that emotionally. We're emotional beings. We've learned to, listen and hear stories, from thousands of years ago, and that's what resonates. And so I think storytelling is really an important part of this equation. And Najee, I don't know whether that's the answer you're looking for, but I think that's really important as scientists and data scientists who sometimes can seem very boring and just crunching numbers.
Yeah, no, well, actually, that was my question. And I think you answered it. The next one was really because you look from a customer lens on those data. So my question was, is data enough to convince? But I think you said it beautifully. It's really about the story and how to shape those data in a language that is emotional enough for patients, for customers to change behavior. I'd love if you have some specific example where actually, because you talked about the actionability of what you do, so I'm intrigued and interested to see how you turn those insights into actions to improve at the end patients' health.
Yeah. I'll give you. I have two, but I'll start with one, and then happy to move on to the second. So the first one actually goes way back when I was working in India on HIV prevention, and there we were working with high-risk groups, and these were sex workers, injecting drug users, and men who had sex with men. And actually, what was really interesting about this program was that community members were people that were leading and delivering this program to their peers. And so here you had sex workers who had to go out to the community to be able to provide the services. And so it was very important for them to know where these members were. And it was very important to them to know, for example, where the nearest healthcare clinic was, where the nearest police station was, where the nearest safe house was, et cetera. And so while the scientists were collecting this data to put in the hands of this community, the question was, how do we communicate this data in a way that they could use? And what they came up with was so interesting, was drawings, right? They took this data, and rather than having these like sheets of like line items of here's where this person is and their address, they actually did these beautiful hand-drawn diagrams where they actually mapped locations, and there were like these children's maps, but they showed where everything was. And so this was for me, it was an incredible example of taking hard data, right, transforming it in a visual story, and then putting it in hands of actually people who deliver health, so that their day-to-day healthcare delivery was effective, and it was. We had a lot of evidence that this worked.
I love this. Can you share the other example?
Yeah, absolutely. Yeah, the other example goes back to COVID, and again, we all lived COVID, and we also know that it was bombardment of information for all of us. And one of the approaches that we took during COVID is actually data visualization, and really, again, bringing art to telling that data story. So we did these amazing stories with the New York Times, and so one of the stories that we did was called "Find Your Line Find Your Place in the Vaccine Line." It was, I think, it was the top read story of the New York Times in that year or something like that. But it, you know, I don't know if you remember, in the early days, we were also concerned, when are we going to get our vaccine shot? How long were we going to wait? Now it's a very different world. And and we had that data. So we actually were able to show which group was going to get their vaccine when across the United States. And they did this beautiful visual where you could go in and put a few of your details, like your age, where you lived, and then they would draw this visual line, and they would tell you, you know, you're going to get your vaccine in 300 days or so. I'm making this up, but it was such an impactful way of actually communicating, you know, this notion of there's an order at which these vaccines are going to be delivered. You know, there's certain priority populations that need to get it first, and it was, you know, so well read, and people resonated with that. People understood it. They understood that whole vaccine delivery schedule, right, that we had in the early days through data and storytelling.
I love it. What you're talking about is just, it resonates so much, right? Like from really data, it's all about data, right? But from data generation to understanding the why, not only the what and what's going on, but also on how you tell and how you share the story to make an impact at the end on people's lives. I want to pivot, though, to a question more on leadership. So you've had several experiences, obviously in a nonprofit, with the Gates Foundation. You're a serial entrepreneur. You've also founded a for-profit company recently. I'd love to get, what are your key learnings from a leadership standpoint that you are taking with you today from all those experiences and running your newest endeavor as a CEO?
Being a leader is you're always learning how to be a leader. I think it's every day you're going, you know, 2 steps forward, 5 steps backwards. It's a never ending, I would say, learning process. And I, you know, I certainly have a long ways to go in that place. So what are some of my learnings? You know, several, but one I would say is that leadership in many ways actually has to be adapted to the culture and context and environment that you're in. You know, I worked in many different countries and many different types of organizations, but I'll give you an example. So when I first started my job in India, that was kind of my first job outside of academia. And I was, you know, leading, you know, these research groups on the ground, you know, really my first job managing teams, or I should say big teams. And I would, you know, show up into these trainings, and, you know, day 1 people show up, day 2 people showed up, and then day 2, day 4, they started like falling, you know, 2 people were missing, 3 people. And then one day I was just so down, and I went home, and, you know, I had a roommate, she was from India, and I said, what is going on? People are not showing up. And she said, you know, you have to adapt to the culture. You know, you have to lead in a way that resonates to them. And so that led me really to introspect and to really adapt. And so, and that was really true across, right? From there, then I moved to, you know, the India office of the Gates Foundation, which was a small team of 15 people that was led by the ex-country head of McKinsey India, that everyone else was ex-McKinsey, and that was a totally different environment. My point is that when you're leading teams, the culture can be so different depending on which country you are and what type of organization you are. And so in many ways, you need to adapt your leadership skills, you know, to that. Really, that was one of my key learnings. The second one, I think, is really being authentic, right? I think in the initial days, I was thinking, well, how do I become like that person or that leader, or, you know, people that I admired? And I quickly learned that that's a bad idea. You are who you are. You cannot change who you are, but you can adapt. But you really need to be authentic, as you know, and you need to be honest and you know, you know, be who you are in that environment. So those were for me the key learnings. I have many, but those I would say stand top for me.
I would give you now one word, and I'd love your reaction to it. So the first one is leadership.
Challenging.
The second one is women in science.
Inspirational.
Can you share a little bit more? I know you're passionate about diversity
Oh,
and women in leadership and
yeah.
science.
I'm very inspired by, well, first of all, I'm a scientist, and I think women in science are really phenomenal, and we need way more of them. And I find it really inspiring to actually coach and develop and have women in science grow. And I've actually dedicated a lot of my, I should say, leadership skills to that as well. So I find it inspiring seeing more women in science.
Can you tell me the number one advice you give to women and young girls that are in science or want to go there?
Be bold, go for it.
The third word is health equity.
A must. I give you a 2-word answer.
I want to hear more about how you look at equity, because I know it's one of the core values of also Surgo.
Yeah, I think we look at equity as something on top, right? Like something else, something in addition. Equity to me is everything. It's core, right? Equity is everyone. Equity means that every single person needs to be part of that, and that's really equity, right? It's not about like there's the core and then there's another group. It really, if you have equitable healthcare, essentially what that means is that you're making sure that the barriers to living a healthy, happy life is for all. You remove the barriers for all, and those barriers exist for all, and they're very different for all, right? For you and I, it may be a time issue, but it really is a must, and that's something we should all strive for everyone.
The last one is spread love in organizations.
It actually reminds me, if you don't mind, Naji, since you brought this. It reminds me of love languages, and this is something I've been thinking a lot about. Talking about leadership. One of the things about leadership I think that's really important is how to motivate. Knowing how to motivate different people, and understanding that different people are motivated by different reasons. And it was really interesting. One of my colleagues, during his first week, shared his love language with me just out of the blue, and said, my love language is words of affirmation. And I was like, okay, I was like, that's weird, sharing your love language. It was first week. But then in retrospect, it is actually, we need our professional love languages, right? We need to understand what is it that really motivates us, or what is it that really gets us, to be loving. And I think that's really important, right? Whether it's words of affirmation, whether it is the outcome, or whether it's a quality time, or you can translate it to work. But sorry, when you said that spread love, it reminded me of the love languages, and I think it's an important piece of the puzzle.
It certainly is, and it's a great reminder for all of us. Any final word of wisdom, Sema, for healthcare leaders around the world?
I think this is, to me, it is the most important, one of our most important topics of our time. And I would say that for everyone, be bold, step up and really go after big ideas. I think we are at a time where we have the opportunity to actually take a lot of big ideas forward and make this something for, health for all. It's really important. So really go for it.
This is such an amazing charge you're leaving us all with. Thank you so much, Sema, for being with me today.
Thank you. It was an honor, Naji. I appreciate it.
Thank you all for listening to Spread Love in Organizations podcast. Subscribe and connect with us on SpreadLoveIO.com or wherever you listen to podcasts. Most importantly, spread love in your organizations and spread the word around you to inspire others and amplify this movement our world so desperately needs.